People and animals have always had a unique relationship. However, increased interaction and encroachment of animals' habitat has resulted into emerging and re-emerging infectious diseases, which has turned out to be costly to human lives. On Health Watch, we take a look at the costly relationship. My name is Saida Hassan. In the last 5 decades, the world has experienced diseases which put a significant burden on global health and economies. Research shows that a lot of emerging and re-emerging infectious diseases are brought about as a result of social, economic, environmental, ecological factors and human behavior. A study carried out between 1940 and 2004 shows that emerging infections are dominated by zoonoses at about 60%, majority originating from wildlife such as Ebola and severe acute respiratory virus SARS. Other emerging diseases are caused by bacteria and superbugs, highlighting the growing number of drug-resistant microbes in the world. Professor Matilu Mwau, a deputy director at the Kenya Medical Research Institute, KEMFRI, and an infectious disease expert, says that humans have encroached wildlife habitats over the years, and this is turning out to be catastrophic.
When you are interacting with the forest, you interact with the animals in the forest. You interact with insects and also animals like bats. Even I'm sure mongooses are in the forest, like there is mongooses, yeah?
Yes.
Monkeys carry viruses. So snakes, even, you know there are viruses that affect snakes.
I didn't know that.
By the way, do you even know there are ticks that eat snakes, ticks that feed on snake blood? Forest is a very bad thing. What humans have done is that some of them are going to the forest like to catch firewood or to do cropping, a certain kind of farming, or they are going to look for fruits and vegetables, or they are going to hunt for animals in the forest, or there are many reasons why. Even there might even be tourists who are going like to Mount Elgon forest. You see, and even in the forest there are caves. Those are the places where viruses are found.
According to the World Health Organization and the World Bank, infectious diseases account for 29 out of 96 causes of human morbidity and mortality and 25% of global deaths. Earlier on, most of the zoonotic causes appeared to originate from Europe and the United States. However, more recently, Asia, Africa and South America seem to be the new hotspots.
The animals are now coming out of their natural habitats and coming to our chambers, like monkeys, because we have encroached on forest land or bushland. Yeah? So then in some places, so we didn't have diagnostics before. Today we know what it is that has killed you. Long ago, you might not have known why you have died, you see. So, for instance, in places like Central Africa, like Gabon or Cameroon, they are catching rats, they are catching monkeys, they are eating them, porcupines, they are eating them, and they are catching viruses. You understand?
Yes.
So they were still doing that Tambo, but we didn't know why they were dying. See? And sometimes a number of them would die very quickly, then the story ends. Because some of the viruses like Ebola, they kill very quickly and then the story ends. Yeah? Because they kill so quickly, you can't go far. Only your village will be wiped out and nobody will have gotten a chance to travel to another village before you're all finished. And then the story ends there. But these days you can catch Ebola today, then you take an aeroplane. You understand? Like some guys took chikungunya to actually they didn't even take. Mosquitoes somehow were blown by the wind and they went to Italy, to Southern Europe, okay? Then those guys found that now they have caught chikungunya for the first time.
One analysis from International Food Policy Research Institute shows that increased population has a direct impact towards such emerging trends of infectious diseases. With increased populations, there is increased demand for milk, meat, and the densities of humans and domestic animals also increases. Some of the recent epidemic zoonoses observed include HIV and AIDS, Ebola, Nipah, severe acute respiratory syndrome SARS, Middle East respiratory syndrome MAS, COVID-19, avian flu and swine flu.
Guinea has confirmed a case of Marburg virus disease in Gekedu, in a locality called Kundu. The significance of this case is important because it's the first case of Marburg virus disease diagnosed in West Africa. And also the area is close to the borders of Sierra Leone and Liberia. So cross-border implications are very serious.
Recently, West African region has been on the spot once again.
The Ministry of Health of Guinea informed WHO of a case of Marburg virus disease in the country's southwest in a man who died 8 days after onset of symptoms. This is the first known case of Marburg in West Africa. WHO and our partners are supporting Guinea's Ministry of Health to investigate the source of the outbreak, trace contacts, and inform the local community about how to protect themselves. About 150 contacts have been identified and are being followed up, including 3 family members and a health worker who have been identified as high-risk close contacts. Marburg is a very different virus to the one that caused COVID-19, but many of the elements of the response are the same: isolating and caring for those infected, tracing and quarantining their contacts, and engaging local communities in the response.
In order for an emerging disease to be established, at least 2 events must occur. An infectious agent ought to be introduced into a vulnerable population, and it should have the ability to spread from person to person, causing disease. In addition, the infection has to be able to sustain itself within the population, causing more people to be infected. Kenya has had its own fair share of outbreaks and epidemics. Since 1980, only 3 cases of Marburg virus have been recorded in the country. 2 in 1980, where 1 person died, and another in 1987, where the patient died. Both patients who succumbed are said to have a history of visiting Kitum Cave in Mount Elgon Park.
There is no licensed vaccine for Marburg, although there are vaccines under development. And WHO is working with our partners to seek opportunities to assess them during this outbreak through the R&D blueprint for epidemics.
Other emerging diseases like chikungunya, Zika virus and dengue have also been recorded in the country. Situation report from the International Federation of Red Cross and Red Crescent Societies released in May this year shows that the County Department of Mombasa reported 24 cases of dengue virus in early March, while another 305 cases turned positive in April in the county. Lamu County has also been affected, with a total of 224 cases being reported, where 59 were children under 5 years of age. A total of 553 cases have been reported in 4 months between January, February, March and April, with a peak of cases being reported in April. No deaths were reported from the 2 counties.
So what's going to happen with global warming is that some places like Europe, which are cold, became a bit warmer, and the mosquitoes started getting happy being there. Okay? The happiness index of mosquitoes improved when they went to Europe. So they became many, like in Southern Europe. And then they started now giving people diseases because they carry them. Every time you are bitten by a mosquito, you can catch something, carry viruses. Yeah? So number 1 is interaction with the habitat. Like forest. Number 2 is dealing with the wild animals, game meat, bush meat, etc. Number 3 is global warming. Now all these things, when you put them together, you can also introduce the concept of easy translocation of Homo sapiens from point A to point B. Homo sapiens can come from today and tomorrow in the evening they'll be in New Zealand. Kweli ama wrong?
Kweli.
And then they'll go and take their yellow fever. Kwisha. When viruses are introduced to communities that were not immune, they spread very quickly. So one of the reasons why they are spreading very quickly is they are being introduced into communities that are not immune. For instance, if you take something like yellow fever to Australia, you will finish all of those people very quickly.
Countries along the West have experienced several emerging diseases. The UN estimates that at least 5 million tons of bushmeat are hunted in the Congo Basin each year. This includes apes, monkeys, rats, bats, and other potential disease carriers. The bushmeat is not only consumed in host countries, the meat is transported to Asia and Latin America. In cities, wild meat is a luxury and it is highly prized, often bought as a way to connect with ancestral traditions or to flaunt wealth.
The outbreaks of viral hemorrhagic fevers, Marburg and Ebola, at a time when COVID-19 cases are rising in a number of West African countries, highlights the multitude of challenges countries are facing in parallel to the pandemic. It also points to the critical importance of sustained investment in preparedness and the resilience of national health systems. The case of Marburg reported in Guinea is the first such case to be reported in West Africa. As WHO, we've assessed the risk of spread as high at that national level and across the African region, considering the porous borders and fragile health systems in the countries.
However, funding and resources to conduct proper research remains low for the emerging diseases.
These infectious agents are neglected diseases. People did not invest a lot in their treatment because they were not found in places where people can invest, where people have the resources to invest. But now, people are paying much more attention to these infections because they have begun to hit places where people have the resources to invest in them, okay? Like Europe, like America. And the investments could come in the form of treatments or in the form of vaccines.
The emphasis now is on having stronger healthcare systems and better vaccines, all of which are crucial. As the world becomes more of a global village, interaction remains a key point and limiting bugs and diseases becomes impossible. Climate change and human interaction with animals are some of the factors that contribute to emerging and re-emerging diseases that can only be mitigated through robust surveillance and investment of adequate resources to mitigate the potential consequences. Saada Hassan for Health Watch, KTN News.